With that, I go to Senator Alsobrooks.
Thank you so much. Good afternoon, Dr. Menares, and good afternoon, Dr. Houry. First of all, I want to thank you for being here today. This is a charged political environment, and being here today took courage. So I want to thank you for your courage. I also want to thank you for your commitment to the truth. Speaking of the truth, today it's been mentioned that there was a, quote, honest problem or honesty problem. Secretary Kennedy in this very room said that he would not fire scientists who were career scientists or working scientists, and he lied when he said that. And so I want to just question first, Dr. Menares. I want to talk to you about the series of things that happened on August 25th. You've described the meeting as animated. I will say it sounded unhinged. But I want to ask you whether Secretary Kennedy, what rationale did he give you for firing career scientists? What did he say the rationale would be?
Yeah, I mean, that was a sequence of events where he had articulated his longstanding concerns related to the CDC, and that the career scientists were part of a group that was part of the most corrupt federal agency in the history of the world, and a number of different items that he had ticked off, including that the CDC employees were killing children and were bought by the pharmaceutical industry and forced people to wear masks and social distancing. So there was a number of different contextual items that he offered related to why those CDC scientists should be fired.
And during that unhinged conversation on August 25th, did he also indicate that he had asked leaders at other agencies within HHS to carry out similar directives to fire scientists and senior officials?
He didn't use the word scientists or senior officials, but he did say that others, and I have, again, no way to substantiate this, but that others at the other organizations, FDA, CMS, and NIH, were engaging in a similar practice of turning over leadership and getting to an organization that would be aligned with his priorities.
So in other words, substituting scientists with people who would rubber stamp his views and opinions.
So he didn't use those exact words, but the idea was to get to an organization that would be aligned and compliant with his administration priorities.
Now, how did he tell you, again, how you should comport yourself with political staff or more specifically his allies? What did he tell you about that?
He said that I needed to surround myself with the politicals and that I needed to listen to them and that I needed to support them with everything that they needed and that I did not need to engage with any of the career scientists.
And again, just so we're reminded, where were you immediately prior to this meeting?
Immediately prior to this hearing today?
Yeah, well, to the meeting on the 25th.
Oh, I'm sorry. Yep. I was, the previous week I had spent in Atlanta with the CDC staff post the shooting, doing a number of activities to make sure that I could ensure their security, help them with the healing process, and then continue the CDC mission.
So I want to ask you very quickly about that. At 5 p.m. on August 8th, a gunman opened fire at the CDC headquarters campus in Atlanta, Georgia, forcing thousands on the campus to lock down. Now, did you receive a call from the secretary upon the first reports that an active shooter on CDC headquarters had shot at employees?
I did not speak to the secretary on the 8th or any successive day. I did not speak to the secretary until August 11th when he came down to visit.
So are you telling me that the Secretary of Health and Human Services failed to even give you a courtesy call upon learning that employees there had been shot at?
He did not call me.
I want to ask Dr. Houry very directly, do you believe that Secretary Kennedy is incompetent and dangerous to the American people's health?
I always believe in optimism and hope, and I would say that was my hope when he started. I'd read his books, and as a transition lead, I was prepared to welcome him. After seeing his Senate finance testimony and the number of misstatements, seeing what he has asked our scientists to do and to compromise our integrity and the children that have died under his watch, I think he should resign.
And finally, I just want to use the last 20 seconds or so I have, Dr. Menares. You've said you agree with the president that vaccines are not controversial because they work. And I am a mother. You are a mother. I would like you to take the last few seconds I have to talk to parents. My greatest concern would be confused parents who have kids who are going to kindergarten, going to daycare. What do you say in this moment about these parents and what should they do regarding vaccines?
Vaccines are safe, they're life-saving, and I would encourage any parent who is concerned about whether or not their child should get a vaccine to talk to their pediatrician, to understand the benefits of these life-saving medical products, and to make the best decision that they can to make sure that their children remain healthy and happy and can go to school and be safe.
Thank you both so much for your integrity and for being here today. Thank you.
Thank you, Senator Alsobrooks.